Hello and welcome. I'm Dilip Pratap Singh. You're joining us on a brand new edition of NewsX A-List, where we bring to you some of the most promising talent of India. Joining us today on the broadcast is Professor Dilip K Prasad. He's a distinguished scientist, entrepreneur and professor at UIT, the Arctic University of Norway. He's widely recognized for his contributions to artificial intelligence and medical technology, particularly in the fields of scalable AI, interpretable deep learning and AI for microscopy. Professor Prasad has consistently featured in Stanford University's list of the top 2% of scientists globally since 2021. With over 150 scientific publications and 3 impactful books to his credit, as the founder of Spermotile, Professor Prasad leads innovation in assisted reproductive technology. The project utilizes AI and advanced microscopy to improve IVF success rates. He's also served as the Chief Operating Officer of Finiac, a medtech startup developing portable head scanners for ICU stroke patient monitoring. Professor Prasad, thank you so much for being with us today on the broadcast.
Thank you.
Professor Prasad, let me begin by asking you about what unique problem, Spermotile is aiming to solve and achieve in the field of assisted reproduction.
So Spermotile is a product for selecting the best quality sperm to be used for assisted reproductive technology such as IVF. Currently, the IVF, the sperm selection is done manually, while Spermotile is using artificial intelligence and fluid mechanics, fluid dynamics and computational electromagnetics control system to achieve a unique patent pending product.
Okay. What was the inspiration then behind this idea of yours? What inspired you to develop Spermotile? And also, I'm sure it wasn't easy. What challenges did you face while building this innovative device?
So the inspiration for developing Spermotile is that there are around 1 million couple in the world who are suffering from fertility issue, and out of them only 3.5 million are able to afford IVF globally annually. So using the Spermotile, we want to increase the success rate of IVF so that this IVF process is available to more and more people, and more couple can become parents sooner than waiting for 5, 10, 15 cycles.
Right. Now, your technology, Professor Prasad, combines AI, fluid mechanics and also microscopy. Could you, help us a bit in explaining how these elements work together to enhance these IVF success rates?
So in Spermotile, there are 3 components are there. One is artificial intelligence that analyzes normally like computer assisted sperm analysis, where the morphology is determined for the sperm. But Spermotile not only analyzes the morphology, it also find out the motion dynamics of the sperm, and that's how we are able to select best quality sperm based on the AI model. Second part is fluid mechanics, where using the natural flow of the nature, the sperms are passed through the fluid and it is getting selected with the help of AI decision making system. And then third part is the computational engine, which helps us in giving us the motion dynamic of the sperm in the thousands and thousands of sperms within real time, and that's how it is a unique product.
Yes. Professor Dilip, how does Spermotile's AI-based computer-assisted sperm analysis stand out from other technologies which are also available in the market? What is the distinguishing feature?
Currently in the market, there are 2 types of way the sperms are selected. One is manually, where the doctors fish each and individual sperm. Typically, it takes 18 to 22 hours to select 10 to 20 sperms. And other one is there is a defined filter sizes there, and sperms are allowed to pass through of a such particular size. So the device which can allow the sperm to pass a particular size, that does not have the motion dynamics, while the human which is selecting the sperm, that is subjected to individual expertise. Spermotile overcome all this subjectivity and lack of precision. We offer the precision with the morphology and AI and motion dynamics, so that the best quality sperm can be selected for a better success rate of IVF process.
Innovation often requires collaboration as well. So tell us a bit about your partnerships with hospitals, research centers, other stakeholders that you must have done while developing this product?
Yes, definitely. The Spermotile is a very complex product. It comes with its challenges like AI, the fluid mechanics, the computational engine. But not only that, what we need are use cases, and that comes from the hospital. So in Spermotile, our collaborator is the largest hospital in the northern Norway, the University of North Norway, and there are other clinics which are also part of it, and there are collaborators like European Sperm Bank, which supplies the sperms for our AI model to build up. And we also have the regulatory compliance agency, we have a business development technology transfer office. So it's a complex process, and there are other researchers from other part of the world which get engaged in the research aspect of the Spermotile.
Spermotile is also part of high impact European innovation programs. What role have the EU funding and programs also like the EIC T2M Pioneer program played in your journey?
Spermotile is funded by two European Union projects, ERC POC and recently EIC Innovation, and together they have funded 3.2 million euro. But this 3.2 million euro is not enough for making a product to the market. So what EIC T2M gives is that it train us through the business aspect of it and the network connectivity in the European and other part of the world, regulatory compliance agency, patent offices, patent agencies, and there are other third party manufacturers who can help us in developing, printing the Spermotile casing, the product materials innovation, and also the speeding the algorithm to the industrial scale.
Right. What are some of the ethical considerations then also, that you keep in mind, that you've also possibly encountered in developing a device for human reproduction? And how did you address those considerations?
We are aware of it. We are developing a device which will be used in a human reproduction. So it comes with a very high sense of ethical responsibility. So our product and the experimentation goes through the institutional review board. We follow the ISO standard, and also we adhere to the new EU AI Act, which needed for every AI model to be used for commercial purposes.
Last couple of questions now before I let you go, Professor. As the founder, how do you balance the technical, entrepreneurial and regulatory challenges of leading a medtech startup?
Spermotile is a product combination of many technical engineering problems. So we collaborate with technical collaborators, and for regulatory aspect we take help of the regulatory agency to prepare us for the CE approval and FDA approval.
Okay. Also, my final question then to you, what is your vision? Where do you see this journey going next? What is your vision for Spermotile in the next 5 years, and how do you see it, Professor Dilip, impacting the overall global IVF industry?
So in next 5 years, we would like to have the Spermotile to be used as a common product in every fertility clinic across the world. We would like to impact as many as infertility suffering couple to become parents and get the joy of a family in their team by selecting the star sperm for their star child.
Okay, well, wishing you all the very best and the entire team for the road ahead. Thank you very much for being with us today on NewsX A-List.
Thank you.